Imagine this for just 10 seconds. A pill meant to help your parent, your grandparent, maybe even you slowly making memory worse, balance weaker, and life shorter. Not because of age, but because no one ever warned you. If you're over 65 or love someone who is, what you're about to hear could literally protect a life. As we grow older, our bodies change in quiet but powerful ways. The liver processes drugs more slowly, the kidneys filter toxins less efficiently, the brain becomes more sensitive to chemicals that once felt harmless. A medicine that helped at 45 can become dangerous at 65. This is not fear-mongering. This is well-established medical science, yet millions of seniors are still prescribed medications that increase the risk of falls, confusion, hospitalizations, and even early death. I want to be very clear right from the beginning. This is not about stopping medicines suddenly, and this is not about blaming doctors. Many of these prescriptions are written with good intentions, but guidelines evolve and busy clinics don't always catch every risk, especially in older adults taking multiple medications at once. What I'm sharing today is based on decades of geriatric research, including what doctors call the Beers criteria, a list used worldwide to identify medications that are especially risky for seniors. If someone I love were over 65, there are 5 types of medicines I would approach with extreme caution. Some I would try to avoid entirely unless absolutely necessary. And I would want every older adult to at least ask one simple question before taking them. Is this still safe for my age? Let's start with the first one, because it's shockingly common and many seniors take it every single night without realizing the danger. Sleep medications and strong anti-anxiety pills. These include drugs often prescribed for insomnia, nerves, or just to relax. They may help someone fall asleep faster, but in older adults, they don't create natural sleep. They sedate the brain, and a sedated brain in an aging body is a serious risk. In people over 65, these medications stay in the system much longer. That means morning grogginess, slower reaction time, and impaired balance even after a full night's sleep. This is one of the leading hidden causes of nighttime falls and hip fractures in seniors. A broken hip at 70 is not like a broken bone at 30. It can permanently change independence, mobility, and lifespan, but the risk doesn't stop there. These medicines are strongly linked to memory problems, worsening confusion, and increased risk of dementia-like symptoms. Many families think aging is the cause when in reality, it's the medication quietly affecting brain chemistry day after day. Even more concerning, when these drugs are taken long-term, the brain can become dependent on them. Stopping suddenly can cause rebound insomnia, anxiety, and even dangerous withdrawal symptoms. That's why so many seniors feel trapped, unable to sleep without the pill, but slowly losing clarity because of it. There are safer, non-drug approaches to sleep and anxiety in older adults that actually improve brain health instead of dulling it. But too often, a prescription is the first and only solution offered. And here's the part most people never hear. Studies show that seniors taking these medications are significantly more likely to be hospitalized within the year, not because of illness, but because of falls, confusion, and accidents that could have been prevented. If someone over 65 is taking a sleep or anxiety medication regularly, it doesn't mean they're doing something wrong. It means they deserve a deeper conversation with their doctor about safer options. That belief, that over-the-counter means harmless, has caused more silent harm in seniors than almost any other misunderstanding in modern health. The second medication I would never casually allow a loved one over 65 to take is certain common allergy and cold medicines, especially older generation antihistamines. These are the ones people reach for when they have sneezing, itching, a runny nose, or can't sleep because of a cold. They've been around for decades, so they feel familiar and safe. But in an aging brain, these medicines can be extremely disruptive. These drugs block a chemical in the brain that is critical for memory, focus, and clear thinking. In younger adults, the effect might just be drowsiness. In older adults, it can trigger confusion, agitation, blurred vision, dry mouth, constipation, and difficulty urinating. Many emergency room visits for sudden confusion in seniors are later traced back to these medications. Here's something heartbreaking. A senior takes a cold medicine for a few nights. Family notices they're suddenly forgetful, disoriented, or not acting like themselves. Everyone fears a stroke or rapid dementia. Tests are done. Stress rises, and then days later, the symptoms fade because the medication finally leaves the body. That is how powerful these drugs can be in older adults. They also significantly increase fall risk. Dizziness, delayed reaction time, and poor coordination make nighttime bathroom trips especially dangerous. One fall can lead to surgery, loss of independence, or months of rehabilitation. What makes this worse is that these medications are often combined into PM, pain relievers, or nighttime formulas. Seniors may not even realize they're taking an antihistamine at all. They think it's just a pain pill or cough syrup. This doesn't mean seniors should suffer through allergies or colds. It means safer alternatives should be chosen, ones that don't interfere with brain chemicals so critical to aging well. Now let's talk about the third medication group. This one is especially tricky because it's often prescribed for pain, arthritis, or chronic discomfort, and many seniors rely on it daily just to get through the day. Certain strong pain medications, especially those that act on the brain and nervous system, carry serious risks in people over 65. Pain is real, and untreated pain destroys quality of life. But in older adults, these medications can suppress breathing, dull awareness, and dramatically increase the risk of falls and fractures. They also slow the gut, leading to severe constipation, one of the most common reasons seniors end up in the hospital. But there's another danger that isn't talked about enough. These drugs can interact dangerously with other common medications seniors take, including blood pressure drugs and sleep aids. When combined, the sedating effects multiply, not add. The result can be extreme drowsiness, confusion, or even loss of consciousness. Long-term use can also change how the brain perceives pain, making it harder to manage discomfort naturally over time. Seniors may find they need higher doses for the same relief, increasing risk with each adjustment. I want to say something important here. This is not about blaming anyone who takes pain medication. It's about understanding that aging bodies process these drugs differently, and what once felt manageable can quietly become dangerous. There are often safer pain management strategies for seniors: targeted movement, physical therapy, topical treatments, and carefully chosen medications with lower brain impact. But these options are rarely discussed unless someone asks. And that brings us to the fourth medication on the list. This one is frequently prescribed for stomach issues, nausea, or even dizziness, and it can quietly worsen balance, movement, and mental sharpness over time. This fourth medication category surprises many families because it's often given to help, not harm, especially for stomach discomfort, nausea, or vertigo. But in older adults, certain anti-nausea and stomach-related drugs can interfere with brain signaling in ways that slowly steal balance, movement, and mental clarity. In seniors, these medications can block dopamine, a chemical the brain needs for smooth movement and coordination. Over time, this can cause stiffness, shuffling when walking, tremors, and slowed reactions. Families may assume it's Parkinson's disease or just aging, when in reality it's a drug effect that crept in quietly. They can also cause restlessness, agitation, and confusion, especially when taken regularly. A senior might feel unable to sit still, anxious for no clear reason, or mentally foggy. Sleep can worsen, appetite can drop. And because these symptoms build gradually, they're often missed until a fall or hospital visit forces a closer look. Another hidden risk is dehydration. Some of these medications reduce thirst signals or cause dry mouth, leading seniors to drink less fluid without realizing it. Dehydration alone can trigger weakness, dizziness, kidney strain, and sudden drops in blood pressure when standing up. Once again, the danger isn't always the medication itself. It's how long it stays in an aging body and how sensitively the senior brain reacts to it. There are often safer alternatives, including non-drug approaches and newer medications with fewer brain effects. But many older adults stay on these drugs for years simply because no one reassessed whether they were still necessary. And now we come to the fifth medication. This one is perhaps the most common of all, prescribed to millions of seniors for heart health, blood pressure, or fluid retention. It can be life-saving when used correctly, but risky when doses aren't carefully tailored for aging kidneys. Certain heart and blood pressure medicines can lower blood pressure too much in older adults, especially when standing or walking. This sudden drop can cause lightheadedness, blurred vision, and fainting. Many serious falls happen not because of poor strength, but because blood pressure falls too fast when a senior gets up from a chair or bed. Older kidneys also struggle to maintain the right balance of fluids and minerals when these medications are too strong. Sodium and potassium levels can shift, leading to weakness, confusion, irregular heart rhythms, or severe fatigue. Families may think the senior is slowing down, when in reality their body chemistry is off balance. What's especially important here is that seniors often lose weight, muscle mass, and kidney efficiency with age. A dose that was perfect at 60 may be too strong at 75. But prescriptions don't automatically adjust themselves. They require review. This is why medication checkups are so critical for older adults. Not just once, but regularly. At least once a year, and anytime there's a fall, confusion, new weakness, or sudden change in health. I want to pause here and say something reassuring. The goal is not fear. The goal is awareness. Many seniors take medications that truly help them live longer and better lives. But the difference between help and harm often comes down to age, appropriate choices, careful monitoring, and asking the right questions. If you're over 65 or care for someone who is, you have every right to ask, is this still the safest option for me? That single question can prevent years of unnecessary suffering. We've now covered the 5 medication groups I would approach with the most caution for anyone over 65, based on science, clinical experience, and what we see every day in real lives. Getting older does not mean becoming fragile by default. Many of the problems we associate with aging, confusion, falls, weakness, loss of independence, are not caused by age alone. Very often, they are caused by medications that were never re-evaluated as the body changed. The most dangerous word in senior health is continue. Continue the same dose, continue the same pill, continue without questioning, because aging is not static. Every year after 65, the brain becomes more sensitive, the kidneys filter more slowly, and balance becomes more delicate. That means medications must be treated like adjustable tools, not lifelong habits. If you remember nothing else from this video, remember this: any sudden change in memory, balance, mood, sleep, or energy in an older adult should trigger one question before panic sets in: could this be the medication? Not a new disease, not just old age, not bad luck. Medication effects are one of the most reversible causes of suffering in seniors if they're recognized in time. This doesn't mean stopping pills on your own. It means having informed, confident conversations with healthcare providers. It means bringing all medications, including over-the-counter ones, to appointments. It means asking for reviews, dose checks, and safer alternatives. And it means families staying involved. One thoughtful question from a son, daughter, or spouse can prevent a fall, a hospital stay, or a permanent loss of independence. Growing older should be about protecting clarity, mobility, dignity, and quality of life, not quietly losing them to pills that no longer fit the body taking them. If this message helps even one family ask better questions, it has done its job. The 5th medication group is one almost every senior recognizes, and that's what makes it especially important to understand. Heart medicines, blood pressure pills, and water tablets are often life-saving. They protect the heart, reduce stroke risk, and prevent dangerous fluid buildup. But after 65, the margin between the right dose and too much becomes very thin. As we age, the body's pressure-regulating system becomes slower to respond. When certain blood pressure medicines are even slightly too strong, they can cause sudden drops in pressure when standing, walking, or getting out of bed. This is why many seniors feel dizzy for a few seconds, see black spots, or feel like they might faint. Those few seconds are enough to cause a serious fall. What makes this more dangerous is that seniors often blame themselves. They think they stood up too fast, didn't eat enough, or are just weak today. So the warning signs are ignored until one day the fall is harder, the injury is worse, and recovery is slower than expected. Water pills, in particular, require close monitoring in older adults. While they reduce swelling and protect the heart, they also flush out essential minerals. When sodium or potassium drops too low, the brain and muscles don't function properly. This can show up as confusion, muscle cramps, extreme fatigue, or irregular heartbeats. Families often describe it as the senior not acting like themselves. Another overlooked issue is weight and muscle loss with age. Many seniors slowly become smaller, even if the scale doesn't change much. Less muscle means less space for medications to distribute safely. A dose that worked perfectly 10 years ago may now be far too strong for the body handling it. The danger here is not that these medicines are bad. It's that they are powerful, and powerful tools require regular adjustment. Yet many seniors stay on the same heart or blood pressure dose for years without a careful review, even after falls, hospitalizations, or kidney changes. When used thoughtfully, these medications save lives. When left on autopilot, they can quietly steal stability, confidence, and independence. And that brings us to the most important truth of all: the safest medication plan for someone over 65 is one that is reviewed, questioned, and personalized again and again. As the body changes, the 5th medication group is one almost every senior recognizes, and that's what makes it especially important to understand. Heart medicines, blood pressure pills, and water tablets are often life-saving. They protect the heart, reduce stroke risk, and prevent dangerous fluid buildup. But after 65, the margin between the right dose and too much becomes very thin. As we age, the body's pressure-regulating system becomes slower to respond. When certain blood pressure medicines are even slightly too strong, they can cause sudden drops in pressure when standing, walking, or getting out of bed. This is why many seniors feel dizzy for a few seconds, see black spots, or feel like they might faint. Those few seconds are enough to cause a serious fall. What makes this more dangerous is that seniors often blame themselves. They think they stood up too fast, didn't eat enough, or are just weak today. So the warning signs are ignored until one day the fall is harder, the injury is worse, and recovery is slower than expected. Water pills, in particular, require close monitoring in older adults. While they reduce swelling and protect the heart, they also flush out essential minerals. When sodium or potassium drops too low, the brain and muscles don't function properly. This can show up as confusion, muscle cramps, extreme fatigue, or irregular heartbeats. Families often describe it as the senior not acting like themselves. Another overlooked issue is weight and muscle loss with age. Many seniors slowly become smaller, even if the scale doesn't change much. Less muscle means less space for medications to distribute safely. A dose that worked perfectly 10 years ago may now be far too strong for the body handling it. The danger here is not that these medicines are bad, it's that they are powerful, and powerful tools require regular adjustment. Yet many seniors stay on the same heart or blood pressure dose for years without a careful review, even after falls, hospitalizations, or kidney changes. When used thoughtfully, these medications save lives. When left on autopilot, they can quietly steal stability, confidence, and independence. And that brings us to the most important truth of all: the safest medication plan for someone over 65 is one that is reviewed, questioned, and personalized again and again. As the body changes, there's something deeply important that often gets missed in conversations about senior health, and it's this: medications don't act alone. They interact with each other inside an aging body. What may be a safe dose on paper can become unsafe when combined with 2, 3, or 5 other drugs that all affect the brain, blood pressure, or kidneys in subtle ways. This is called polypharmacy, and it's one of the biggest hidden risks for people over 65. Each additional medication increases the chance of side effects, drug interactions, and confusion, not just mental confusion, but confusion about which pill does what, when to take it, or whether it was already taken. One missed dose or one extra dose can change an entire day. Many seniors don't want to complain. They don't want to seem difficult or ungrateful. So when they feel dizzy, foggy, weak, or unsteady, they often stay quiet. They assume it's normal aging. But silence is exactly how medication problems grow unnoticed. Research consistently shows that reducing unnecessary medications in seniors often improves memory, balance, energy, and even mood, sometimes within weeks. Not because something new was added, but because something harmful was removed. This is why medication reviews are not optional for older adults. They are essential health maintenance, just like checking blood pressure or blood sugar. Anytime there is a fall, a hospital stay, sudden confusion, or a major change in daily function, medication should be the first thing reviewed, not the last. And here's a powerful truth many families don't realize. Doctors often welcome these conversations. They don't see them as challenges, they see them as teamwork. A patient or family member who asks thoughtful questions helps the doctor make safer, better decisions. Aging well is not about taking more pills. It's about taking the right ones, at the right dose, for the right reasons, and letting go of those that no longer serve the body you have today. We are now just one step away from bringing everything together into a final message that every person over 65 and everyone who loves them needs to hear.